So this is a review for acupuncture. If you are taking your boards or if you just want a full depth review, then this will be the video that you would want to watch. So there's 6 depth, right, of meridians and collaterals. Now, we refer it as meridians and we refer it as collaterals, right? Meridians are considered to be bigger than collaterals, right? And that's only because meridians are kind of focusing more like in the primary, right? And the collaterals will be focusing more on the secondary. So that's why we name it as meridians and collaterals. You'll see later because when it's listed from its most superficial to the deepest layers, this is how we would reference them, meridians or collaterals. You can think of meridians as something like arteries and collaterals as something like capillaries, in the idea that one is kind of bigger, right, and the other one is like smaller, like secondary. So the functions of the meridians and collaterals, the best way to remember this is when we are thinking about fundamentals of Chinese medicine, right? We think about the functions of the qi and blood together, the yin and yang together, and the deficiency and access. It's also what we ask, right, in questions, in the 10 questions when we are doing intake for patients. So you can kind of remember it that way. So it transports qi and blood, right, and it balances by regulating the yin and yang and the deficiencies and access. So you can group them together like this and think of it in that way so you remember, oh, okay, I see. The whole system, right, of all of these layers together, right, they all do something together, which is what transports qi and blood, right, but at various levels, and they have their limitations. And then they balance, when you're in a treatment, you're trying to balance the yin and yang, right, and you're doing it by regulating it. And same thing with deficiency and access. If there's deficiencies, if there's access, we're trying to balance it out. So that's how you can recall it. So in other words, like, don't just try to memorize, try to think about what it actually does. And it'll be less memorization, but more knowing. And then the other thing is these meridians, right, and collaterals, they're there to kind of signal the body, right, through the body, the symptoms and signs, right, to let the practitioner know, hey, there's something going on. These are the patterns I'm showing. So that's what the meridians and collaterals actually do. Because what the physical body is the last manifestation, right? It's the place that appears where our problems are or troubles are, right? So that's how you can remember the functions. Now we're going to go for the most superficial to the deepest layers. There's a reason why I put this line here. I kind of see this as the imaginary line that divides the superficial, right, and then the deepest layers, right? So the most superficial layer, cutaneous, considered to be like the skin region, right? And then it's the muscular, right? Under the skin there's muscles, right? And then the luo. Luo is like that part where it's right before like it starts to get deep, and then it's still in the superficial layer, so it kind of acts as a liaison for the primary and the superficial area to kind of link together, and that's what the luo collaterals actually do. Okay, and the primary, of course, right, the primary, we all know what that is. And then it's after that, it's a divergent. So the divergent also behaves like a liaison for the primary as well, but it's more on a deeper level. It's how it operates, but it's still a branch that's internal that helps to regulate the secondary pathway, right? But they also work together with the in support of the primary. And then we have the extraordinary or the confluent. There's 8 of them. They're specific points on the primary meridian that connects with the extraordinary vessels, allowing the body to harmonize at a deeper level. So you would use this when it's like really like the disease or the problem is more, it's more on a deeper level. And in the divergent, you'll see it kind of works like a liaison with the luo, but it's slightly different, and you're gonna see that at the as we go through these slides. So we're gonna first go over cutaneous. There's 12 only because there's 12 primary channels, so it's considered a skin. The definition would be the regionalized it's regionalized on the surface of the body according to the distributions of the channels. Now the function is like it goes from the skin, right? And as I said, collateral is a smaller channel. Meridians refer to the main channel, and then we go to the Zhangfu connection, and that's what the skin does. It's the most superficial, but through the skin when we're needling, it's we go through those layers deeper and deeper, right? Not just because how deeper the needles actually go, but it's through the treatments, right? That's what it triggers different areas, the way how we do our treatment method. But in general, the cutaneous region is a protective barrier, right? It reflects our imbalances, right? Because sometimes just through the skin is how it expresses the signs and symptoms of certain diseases, right? And it guides the disease and treatment. What this means is it's the only way we kind of can see, right, through these patterns on the skin and stuff, that we are able to figure out what's the disease this person may be dealing with. What could be the treatment method, right? So that's what the skin does. And, we have many different modalities when it comes to acupuncture. One that pertains to the cutaneous region would be like gua sha and acupressure, right? Because we're still on the outside of the skin. Some people may say cupping, yes, to a certain degree, but I'm going to put cupping in the muscular, which is the next one. So muscular is 12, right? Because there's 12 channels. So this is something we have to remember. It all starts from the extremities, meaning wherever the primary channels are, the point that is at the fingertips or the toes, that's their starting point for that particular channel, for the muscular channel. And all the yang channels go to the head, and all the yin channels eventually go to the trunk of the body. Okay? So it's always like the fingers and then the toes, no matter where they may be, right? So the three, hand yins, hand yangs, or the three leg yangs, they all end up going somewhere in part of a human's head. And then all the yins, eventually where it's three hand yin or three leg yin, they all eventually go to the trunk somewhere of the body, okay? The only thing that we have to remember is that it goes to the major muscle groups and the tendons, and the ligaments. However, it never goes to the zhangfu. It's too superficial. That's what I'm saying. This is why it's listed that way, cutaneous and it's muscular. I put cupping as a modality that can signal for muscular channels, okay? Because it's creating space between the muscles, right, and the skin, so that blood can go through, right, to have it heal, right, or have heat released through the skin. That's what cupping is, right? It helps with the circulation, but still in a very superficial level. So there's another thing that you should also recall is that the muscular meeting points. So there's certain meeting points for these groups of yin and yang, hand and leg. So there's a way to remember this, okay? Since all the yangs, right, whether it's three hand yang or the three leg yang, they all go where? Somewhere in the head. But we have to remember that the hands are they're higher, right, in reach than the legs. The legs are lower part of the body. And so the best way to remember where in the head is it, so if we know that if it's the forehead or the eyes, we should know it's the three hand yangs that goes to the forehead, and it's not the eyes. Because when you think about it atomically, the forehead is higher than the eyes, the way it's situated. So that's how you can remember it. So you don't get confused that way. And same thing with the three hand yins. It's going to eventually go to the trunk of the body, but it's the thoracic cavity and then it's the genital region. Thoracic cavity is situated higher, right, anatomically, than the genital region. That's one of the best ways you can remember this, and then you just remember the 4 points, but you know where it goes with. Oh, okay, these 2 points happen to go to the head. So that means that it's going to be pertaining to the yangs. Now, if I'm left just with these two, you're thinking, okay, the forehead's like higher atomically in the region of the body, it must pertain to the three-hand yang. So it's something like that, okay? So the three-hand yins, it goes to the thoracic cavity, or GB22. It's in the mid-axillary, fifth intercostal space. Three-leg yins go to the genital region, Ren 3, right? So then it would be, this is the umbilicus, and it's 4 soon down. We know that from the pubic symphysis, right? And to the belly button, it's about 5 soon. So this is about 4, 1, 2, 3, 4 down. Okay, that's where Ren 3 is. And then we have the forehead, right, for the three hand yangs. The forehead, where GB13. This is in line with Du 24. This is why 0 point soon within the anterior hairline, right? It goes more this way and then it goes that way. And that's how you get GB13. But it's what? If this is the middle of the, this is the hairline, right? This is right in the center. That's where Du 24 is. It says 2/3 this way. So this is cut into 3. You have to think about it that way. And it's what? 1, 2. And that's where GB13 would be. And then 3-leg yins is going to go where? The eye area, right? So the eye area, this is more medial and this is more lateral, but we know where stomach 3 is and we know where SI18 is, right? So stomach 3 is directly below the pupil, right? Level with the border of the Li nazi. That's where stomach 3 is. SI18 directly below the outer canthus, right? Lower border of the zygomatic bone. That's where stomach 18 is. So that's how you recall. So three hand yins are gonna go to GB22, and then 3-leg yins are gonna go to Ren 3, which is 4 soons down from the umbilicus, or 1 soon up from the pubic symphysis. And then the 3-hand yang is gonna go to the forehead, GB13, 0.5 anterior to the headline. And then when it's cut into 3/3, it's 2/3 laterally. And then we have 3-leg yangs. It's gonna go where? It's gonna go somewhere by the eyes, right? And that's gonna be stomach 3, and it's going to be SI18. Stomach 3 is what? Directly below the pupil, and it's lateral to the Li nazi, right? Border of the Li nazi. And then SI18 is at the outer canthus, and it goes where? Right below the zygomatic bone. So that's how you recall, okay? We're gonna go more in depth, but this is the run through. And then now we have the lual collaterals. What does it do? It connect with the pair channel. So it's if we're doing lung, right? And we have lung 7. It's through lung 7 point, right? It connects to the Li channel, which is its pair channel, right? They're both metal. And it continues to follow the pathway. So it connects what? Superficially in the primary. As I said, luals acts as a what? Liaison, right? Between the primary and the superficial area. So that's what it's doing. So these are all the lual points. We're going to go through all of those. We're going to have this memorized when we go through each of the channel of the primary channels separately. But we know that where is it going to, right? And the symptoms that's associated in helping to treat, okay? Okay, now the divergent. So divergent can be a little bit tricky because I don't think a lot of the professors sometimes take their time. But this one is also a liaison, but it's a liaison that kind of acts at from a deeper level. So there's yang and yin, okay, more associated with this. So the yang, right, being yang, it diverges and then it goes in the primary and then it emerges through its own primary. But the yin actually goes to its own primary, but it merges to the yang. So you can think of it as the woman is supporting the yang, as in like the yin supports the yang. And don't get politically trying to correct me with this. I'm just using it in this way because that's the way how Chinese medicine is. That yin is like more associated with woman, female, right? And yang is more for male, right? So then we see it as that the female always plays a supporting role to the yang, although both need to be in existence together and they both need to be in existence to balance, Okay, so the yang, divergent, and primary enables the four yins. The four yins we talk about are these four, because we'll later see that the liver and the heart has its own are exceptional, and it helps to connect the body at the top of the body. So what this means is, I say this as if the yins, right, the four yins, the lung, kidney, spleen, and PC, happens to ride on a turtle, which is the yang, and it carries the four of them, and it transports them to the top of the body, because yin is usually associated with being at the bottom, because yang is more tense, it's associated with rising, and yin is more deeper, like the water. So it's helping to get the yin energy here up by riding on the turtle yang. That's how I think about it. Because look, it strengthens, and because of this reason, look, it strengthens the yin and yang relationship between internally and external, channels and zhangfu. See how here it says zhangfu? Because it's deeper now. But it also helps internal, external channels. It helps to link. So it acts as a liaison, but it also acts as a liaison between the yin and yangs. So it's not also helping it to connect with the outer superficial, but also internal, but also making sure that the internal yin and yang is balanced too. That's what the divergent does. See, integrates areas of body not supplied by the interconnected by primary. This is why this is here. These. What does it do? It distributes qi and blood to head and face, because this is still riding the yang turtle. That's how I think about it. It helps the qi and blood to the head and face, except the heart and liver. So you can think of it as, in the divergent, it helps not only the superficial and the deeper layers to connect better together. That's not really done by the primary. So it fills in a job that the primary is not doing, but it also balances the yin and yang in the inside of the deeper channels of the body. And the way they do it is that there's a little turtle, right, which is the yang, takes the lungs, kidney, spleen, and PC, which is the four yins. Exception is the liver and the heart. This is not it. These two don't, but they help them to go to the head and face. And why is it the head and face? Well, we just explained before. The head and face is considered to be, upper, yang. You can also think of it as that even in the muscular channel, we associate that it's going to go to the head somewhere, right? The yang. The primary channel do not go to the head and face. And so the reason that this becomes this way, think about it. See, the heart and liver, without the yang turtle, right, to ride on, it can still go to the head and face. But these four here, they don't go to the head and face. So that's why this divergent channel is necessary. So these four, I'm going to write it in here. That's legible. See, these four do not. So the divergent channel helps these four to reach the head and face, which is not going to happen for these four channels. However, for the heart and liver, it does. Now, a lot of people may not remember this, but the internal branch for the heart goes to the tongue and eyes. Tongue and our eyes are where? At the head and the face. And then the liver is the same. It goes to the eyes and the vertex of the head. And because of these of this reason. It's the reason why the heart and liver is the only exception, where the yin does not go there. But the other four, they need the help from the divergent channel in order to help to distribute the qi and blood to the head and face through these channels of these four. Do you guys get it now? Okay. Okay, now the six extraordinary. They act as a reservoir, okay? And they link the 12 primary channels. So remember I said there's a point in the primary channel. And it's through that primary channel that we're going to discuss down here is how we get access to the the extraordinary. Sorry, it's the six deepest it's the deepest of the six channels, right? But there's 8. Okay, let's not get this confused. I just got confused almost looking at the slide. And there's 4 pairs. So the way I remember these pairs is like this. So we know that there's Ren, and then there's Du, and then there's Chong, and then there's Dai. We know that the Ren and the Chong is more towards an association with female, right? Because Ren is the front of the body, right? Du is the back. And Dai is also kind of the back as well. It's like the spine. And the Chong is associated with, the spleen a lot, right? And it's also had to deal with menses. And so you can remember it that way. These are the yin areas, and then these are the more yang areas. But the way I remember it is when we study the 12 primary channels, right? The 2 that gets extra added is the Ren and the Du. We can think of it as they're still part of family, okay? And because of that reason, I associate that the Yin Chao and the Yang Chao is going to be linked with the Ren or the Du. And this is because I know a little bit of Chinese. Wei, usually I associate it as that, outsider, foreign. Because of that reason, I consider that the Ren and Du is part of the primary and the, a little extra, right? But they're still part of the family. But Yin, right, is associated with the Ren, and so that's why it's with Yin Chao. Because sometimes people get confused, who do they pair with? So this is one of the easiest ways to, I think, remember it this way. Du is more associated with Yang, and it's still Qiao. But Chong and Dai, they don't really have a separate, channel system, like the Du and the Ren, as you know, right? So for that purpose and that reason, Chong is associated still with the Yin, but it's an outsider, so it's Wei. Dai is what? It's still an outsider, but it's still associated with the Yang, so it's with Wei. So that's how you remember. Chong is with Yin Wei, Dai is with Yang Wei. So at least you know who pairs with whom, so you don't get confused. Now you have to remember, the order that you actually use the extraordinary vessels as a treatment, the pairs, is very important, because there's a leading pair, which is called the leading point, which is called the master point, and then the following, which is a couple point. So the order is interchangeable. This changes the treatment symptom. What that means is when you put lung 7 and kidney 6, it's going to treat something different from when you're actually doing kidney 6 and then lung 7. We're going to go in there further, but now look, in order to activate the Ren, where do we needle? Lung 7. Yin Chao, it needs to be where? Kidney 6. Du, it needs to be SI3. Yang Chao is going to always be UB62. If we want to activate Chong, we have to needle spleen 4. Yin Wei is always going to be where? PC6. Dai is going to be GB41. Yang Wei is going to be Sanjiao 5. So that's how we recall. Okay, that's a wrap for the review for the 6 meridians and the collaterals. We're going to later go through each of the channels, and we're going to go through a full depth review for all the 12 channels, plus the Ren and Du, and the extraordinary, right? We're going to, for each of the channels, also go through their muscular channels, of course, right? And the divergent, and then the luos, and everything else in between. And but anywho, this is a wrap. Thank you.